Hello, I'm Dr. Rohini. Today I'm going to talk about a condition called adenomyosis, which is closely associated with infertility in women. So, what is adenomyosis? So, in adenomyosis, basically what happens is the endometrial lining and endometrial glands are present within the myometrium. So, what does this imply? So, basically, every month, what happens because of the hormonal changes, we have menstrual bleeding when these endometrial glands are shed and there is bleeding from inside the uterus, which comes out as menstrual blood. But now, in case of adenomyosis, since these glands are present within the myometrium, so these glands also bleed monthly during the time of menstrual cycle, and this causes bleeding and clots within the myometrium and causes changes and inflammation, and this condition is called adenomyosis. So now how would you know that the patient, or like if you are having adenomyosis? So there is certain symptoms. First of all, women with this condition have severe pain during periods, severe dysmenorrhea, and this pain starts 2 to 3 days before the periods, and it gets relieved in the first 2 days of the periods, or sometimes they may experience pain even after the periods. So that is one thing. Second, they might experience painful intercourse, and third thing, they might also experience heavy menstrual bleeding. So in case if you are having any of these symptoms, then you should go and get yourself checked. So now when you come to the clinic, how will we diagnose and confirm whether you are having adenomyosis? So when you come to the clinic, first of all, we would ask a detailed history from you, and if you have any of these symptoms, this would give us a suspicion that you might be having adenomyosis. So the next step, we would be examining you. So on an examination also, what we find is sometimes the uterus size may be increased, and second, while doing a pelvic or pervaginal examination, the patient may experience a lot of severe pain. So that also gives a clue. Next, we would be doing an ultrasound. Now, there are certain ultrasound features which will give us an idea. First, there may be the adenomyosis can be present as a focal mass called as adenomyoma, and sometimes the endomyometrial junction is not clearly maintained in this case, and also we can find some myometrial cysts within the myometrium. So these are some findings which gives us an idea, which gives the clinician an idea. Sometimes there is nothing found on ultrasound, so and patient continues to have a lot of pain, and in that case we do a diagnostic laparoscopy for the patient, and sometimes in that also we would come to a diagnosis because the uterus looks very broad based and the fundus looks broad based in the laparoscopy, and uterus is also very bulky. That gives us an idea. Now next is, what is the treatment? So usually all the cause of this adenomyosis is hyperestrogenic. There are many reasons. It can be because of genetic involvement, environmental factors, but one of the common reasons is increased estrogenic state. So there are certain hormonal treatments for this. We give oral contraceptive pills which will suppress the hormone levels, and these glands, because of which these glands will not bleed every month. And the next treatment is some injections called as GnRH injections, growth hormone releasing injections, which will completely suppress all the hormone levels. But also the disadvantage is it mimics something kind of a menopause kind of state for a few months for the patient. So sometimes this will reduce the bone mineral density for the patient, and patient may experience hot flushes, basically all menopause related symptoms. But this is very temporary, and once the injections are stopped, within 2 to 3 months you will regain your normal menstrual cycles, and all these side effects will fade away. Next treatment is an intrauterine device called as Mirena. So it is a levonorgestrel containing intrauterine device. So this intrauterine device will be put inside the uterine cavity under ultrasound guidance, and this will keep secreting hormones daily at a particular rate. So the advantage of this device is that you will not have the side effects with other hormonal pills like headache, nausea, bloating sensation, because it has a very localized effect. And but the problem is it causes irregular periods and spotting, and this can be kept for at least 5 years inside the uterus. So all the treatments that I told you, they are for symptom relief, but they will not help you get pregnant. In fact, they will suppress ovulation, and patient will not be able to conceive in this period. So when patient comes to us, we try to we start treatment for the patient as soon as possible, and we tell the patient why we should do that, why adenomyosis actually causes infertility. So there are various reasons for this. First of all, it causes abnormal contractions and abnormal motility of the tube. So even when the egg is released, it may not reach the uterus on time. There will be asynchronization in the fertilization because the sperm and egg do not meet, and there is also increased contractions inside the uterus. So even if the implantation happens, the embryo might be pushed out of the uterus. And there is also abnormal blood circulation to the uterus in case of adenomyosis. That also gives improper blood supply to the uterus and to the growing embryo. So this also is one of the reason. So when a patient comes to us, we start with simple procedures like ovulation induction or IUI. But if it is a complicated case, if it is associated with endometriosis, then we counsel the patient to directly go for advanced reproductive techniques like IVF. But also it is concerning that we do counsel the patient, even if they go for IVF, there is definitely a chance that the failure rates are slightly more compared to other women. Another one option is that in case if there is a very big adenomyoma, then we also opt for surgery and adenomyomectomy. This is a laparoscopic procedure where we will be removing the mass from the uterus. And but then this differs case to case, depends on the patient's uh, current situation, the scan findings and everything. So there is lot more to talk about this, but I think today I would have managed to give you a brief gist about the condition. And in case if you have any further doubts, please reach out to us.